Welcome to episode 82 of Talking Dairy. I'm your host, Jac McGowan, and today we're going to be talking about preventing down cows over the calving period, plus diving into the care and recovery for the small number of cows who do go down. It's a situation no one wants to face, but knowing how to handle it can make all the difference. Joining us today is veterinarian Mitch Cooper. He's DairyNZ's Senior Technical and Policy Advisor, and he works across our biosecurity and animal care programs. He joined DairyNZ a year ago after a decade working as a dairy vet in the Waikato. As a vet, Mitch worked with farmers to develop prevention strategies for down cows, as well as care plans and staff training for any cows that did become unwell. Tēnā koe, welcome Mitch. Thanks for joining us. Before we talk cows, let's talk about you. Where do you hail from and how did you end up becoming a vet?
So, much to the chagrin of most dairy farmers, I grew up in the middle of Auckland and decided I wanted to be a vet pretty early on in life. Went to vet school, spent a bit of time on a couple of farms, fell in love with farming. And then when I graduated, I went straight into a mixed practice in the Waikato. And bar a short stint overseas, I never really left.
So Auckland you grew up in?
Yep, middle of Auckland.
But the Waikato's clearly better?
100%. I have lived in the Waikato for most of the last 12 years and I don't want to change that anytime soon.
Okay, so today we're talking about down cows and farmers listening will obviously know what that means, but can you explain it for a layperson? What is a down cow?
The general definition is, for one reason or another, normally it's a metabolic issue. The cow has gone down and can't get back up by herself and requires some sort of intervention on behalf of the farmer to be able to get up.
Okay, so when it comes to herd health, we all know prevention is better than cure. What can farmers do to prevent down cows?
So if we take it, I think, all the way back many, many months before the spring period, which is normally when our issues happen, there's a lot of steps we can get right to make sure that we reduce our risks. First choice is bull management. It's not normally a problem for your average artificially inseminated dairy cow that's well grown. Bulls aren't often a source of down cow problems, but for heifers and bull management for later calving cows, particularly if they're beef cows, sometimes I have seen scenarios where you have a whole mob of heifers mated to a bull where they're just producing these absolutely monstrous calves. So bull management's pretty critical. We then come forward in time to body condition score, and obviously a lot of those decisions are made at dry off time. And so we've got to make sure we're drying them off at the right body condition score and at the right time to make sure that they're calving in the right body condition score. And that goes for cows and heifers. We want cows calving at body condition score 5 and heifers at 5.5. So once we've got the body condition score side of things sorted, we then go to the transition period. And a huge amount of that is what we're feeding them and how much we're feeding them realistically. There's a big component of that is energy content and how much energy, but also, and particularly as we are finding more and more information with wearable technology, we're starting to get a much better understanding of things like eating time and how much of an impact that has on their ability to then calve and eat adequately afterwards, which hugely reduces their risks of going down. And a lot of that is influenced by the feed makeup, how much fibre, how much protein, how much energy there is. So there's a huge impact of nutrition in there. Next, we've got minerals. So the classic ones are magnesium, calcium, and to a degree phosphorus, although it varies a little bit farm to farm as to how important phosphorus is. It's not a problem on most farms, but we have seen probably a slow increase in issues on some farms since I've started as a clinical vet anyway. So getting your magnesium supplementation, getting your calcium supplementation correct is the next sort of critical step in making sure that that all goes smoothly. And that sort of flows then into the colostrum period. And once you're in the colostrum period, a huge amount of it is feed and minerals from there.
Can I just circle back to body condition score? What were those targets again?
So for adult cows, mixed age cows, it's body condition score 5. And for heifers and ideally 3-year-olds, body condition score 5.5.
Great, thank you. And so what are some early signs to look out for so that we can know if a cow is going to go down or not?
Most of it's sort of observation, and a lot of them will they're a bit slow when you're getting them into the shed. They may be isolating themselves in the paddock. They're not eating that normally. Sometimes once you get into the shed, they can be a bit wobbly, and that can be a little bit dangerous sometimes, particularly in a rotary milking shed where there's lots of moving parts and wobbly cows. One of the big revelations that sort of happened in the last 5 years is wearable technology has allowed some pretty good early identification of these cows in the paddock, sometimes before you've even seen them. But a lot of it is largely sort of observation and making sure you're keeping an eye on them on a pretty regular basis around that time they calve and when they're in the colostrum period.
So obviously, despite all our prevention, sometimes a small number of cows still require treatment. What should farmers look for to assess what's going on and understand how to treat them?
The vast majority of these cows are down for metabolic reasons. So they've either normally got a deficiency in calcium or magnesium, and the vast majority of those are the ones that farmers deal with and vets never see. They give them a metabolic product, normally an intravenous or a bag under the skin or both, and they get back up. Normally those cows are sort of a little bit weak, a little bit wobbly. They sit down and they sort of flop their head off to the side. Often they stop eating for a little bit, or maybe they're eating and they can often try and get up, but they just can't quite get there. That's the most common ones we see for sure.
Okay, thanks, Mitch. Around calving, the most common causes are metabolic or calving injury. So what do farmers need to think about in terms of treatment?
The general thing I often try to get farmers to do is throw everything at them. These cows are often struggling, and once they're down and they've been down for a little while, they start progressively struggling more and more quite quickly. The longer they're down, the worse it gets. They get a lot of muscle damage very quickly, and it can turn what started as a relatively straightforward metabolic issue that you could have given her a bag and she's jumped straight back up into a complex, challenging down cow. So the general recommendation I had is throw everything at her. And normally by everything, I mean a couple of metabolic bags. It's quite standard for a farmer to give a bag in the vein, bag under the skin. What a lot of people don't do is they don't then follow up with more calcium or more something else later on. And what is a pretty good recommendation for a lot of farmers is once that cow is looking pretty bright, looking pretty alert, ideally she's up and she's got to the shed, to try and reduce the risk of her going down is giving some sort of oral calcium product, and ideally long-acting oral calcium products. There's quite a few boluses and liquid supplements on the market that people can give to try and keep them up. The other thing that we recommend pretty regularly is giving them anti-inflammatories, almost irrespective of the reason they're down. As I said before, the longer they're down, the more muscle damage they get and the more nerve paralysis they can get just from lying on their legs. Cows aren't super well designed to lie down in uncomfortable, abnormal positions for long periods of time. So getting into them quickly with anti-inflammatories can make a pretty significant difference to their recovery. Other than that, it is quite specific as to why they've gone down, as to what else you can do, but being pretty particular about making sure their metabolic needs are taken care of and anti-inflammatories and good care afterwards goes a long way towards getting them up and keeping them up.
So get in early, both with diagnosis, a proper diagnosis, and with treatment. Talk to us about what else we can do to prevent that muscle damage. I remember when I started farming, it was pretty common that we would lift the cows with hip lifters, but over time that sort of advice has changed a little bit.
Yeah, there's a lot of things we can do from a care perspective to maximise the chances that these girls are going to get up. A couple of big things are feed and water. So particularly if they're down for any period of time and they've eaten all the grass around them and they're still relatively bright, we've got to be offering them a reasonable amount of feed, because their feed intake in that sort of post-calving period ramps up really, really quickly. So the ability to not just bring a couple of handfuls of hay, but decent part of a bale of silage or not too much palm kernel, but a bunch of palm kernel or some other feed source to the cow is a good idea, as well as lots of water. Their water requirements are massive. So multiple 20-litre buckets, multiple times a day. Every time you see her bringing her new water is always a good idea. They can drink huge, huge amounts of water. And I've seen a number of cows when I've gone out on farm to look at a down cow where the first thing we do is just bring her a bunch of feed and bring her a bunch of water, and you'd be amazed how quickly they can drink 2 buckets of water in the space of a couple of minutes, simply because they're so thirsty. They need that water intake to start producing milk. So feed and water are 2 big things. It can get pretty cold around calving, and once they're down, in particular with metabolic issues, it prevents them from being able to shiver properly and prevents them then from being able to properly thermoregulate and maintain their heat, because calcium deficiency stops muscle contraction from happening effectively. And so what we sometimes see if they are calcium deficient is once you give them calcium in the vein and under the skin and supplement that calcium, they'll start shivering through that process. And that often means that suddenly the calcium balance is getting a little bit better and those muscles can contract as they should. So that's actually quite a positive sign, is in the middle of treating a cow, she starts shivering. Great. Maybe she's got enough calcium to get back up.
Wow, I never understood what the shivering was about.
Yeah.
Makes sense, though.
Pretty handy little tip. So pretty critical, because they can't maintain their body heat, is to support them in doing that. Cow covers are pretty common, and a couple of cow covers, particularly in pouring rain, are a good idea. If you can't move them out of the paddock or can't move them out of the paddock yet, just putting one on them and helping them out with that thermoregulation. Moving them to a better area is often a pretty critical part of this, particularly if they've been down for a few hours and they're not looking like they're going to get up immediately. Moving them can be pretty useful.
So how should I move her?
Not with hip lifters would be the big thing I'd say.
Why is that?
It can cause a lot of damage. And what's happening with hip lifters is where it's attaching on the cow is you're actually attaching it to the front of their pelvis. And so you're lifting the cow from her pelvis, and that can do a lot of damage. We can move them short distances with hip lifters and a chest strap, because that's then at least distributing the weight a little bit better. Preferably all we're doing is lifting these cows to their feet to allow them to support their own weight. And what I have seen quite successfully in a number of these cows, you lift them to that point, they can support their own weight, and they can kind of then walk as you're sort of gently following them with a tractor, still providing that support because they're still pretty wobbly, but they can then walk to a better piece of pasture where it's sort of fresh and maybe it's a little bit drier and there's some decent grass around them. So again, you can provide them with a bit better feed. So that's okay. A sling where it properly really distributes weight over the whole cow would definitely be a better option. Seen some pretty good setups where farmers have, say, like an old disused hay barn where they've set up a nice big area of bedding with some hay. It's nice and warm, it's out of the elements, and if you can safely and appropriately transport your cow to an old hay barn and set them up there and really take good care of them, the chances they'll get back up are much, much higher.
Yeah, and I think, well, obviously, they want the same kind of care that we require, right? So, whether it's in the paddock or the nursing area, they need to be warm, they need to be well fed, they need to have the water and the medical treatment they require. I think the other thing that we noticed when we started moving cows into a nice warm area closer to the cow shed was that it was easier for us to do that care. It wasn't such a trip. We could check in on them more often. So I think it also helps the farm team to lift the standard. Okay, so we've talked about down cows in terms of keeping them warm and dry and fed and medical treatment and water. Talk to us about rolling. It sounds like a challenge to roll a 500 kilogram cow. Tell us how we should do that and when we should do it.
Yep, no doubt about it. Rolling a 500 kilogram cow is hard work. So first tip, multiple people. It is really, really hard to roll a cow by yourself. I have seen it done plenty of times, but it is really, really hard, particularly when you're rolling them multiple times a day. It can take a pretty physical toll on you. But the key is, and we talked about this earlier, the longer they're down, the more muscle damage they get. The key is then not allowing them to sit on the same legs and the same side for too many hours at a time. So ideally rolling them every 3 hours. I'd say a minimum of 4 times a day. The more often you're rolling these girls, the better chances you've got of getting them up. And sometimes it's a case of sort of every time you're going to be driving in that area is popping into the paddock, rolling her over. Again, I'm aware it is quite challenging because it can take a couple of people. Sometimes if you've got the tractor still just sitting in the paddock and you've got the hip lifters set up, you can use the hip lifters to just sort of gently pick them up enough so that you can then help the rolling procedure and then put them straight back down. And that can be quite useful. But the more often we roll them, the less chronic muscle damage we're going to get. And those cows then hopefully have a much better chance of getting back up.
Yep, I've rolled a few cows in my time. You feel surprisingly strong, though, when you follow the right technique. And there is guidance on the DairyNZ website about how to do that. There's some really good diagrams for where to stand and where to put your hands. So we've talked about the care that the farmer provides. When should we get a vet involved or change what we're doing?
First scenario is when you've got a lot of down cows. That's a pretty good time to get a vet involved. We're not necessarily, I guess, dealing with the individual down cow at that point, but there is an underlying problem that we need to figure out, and we need to figure out very quickly. Second time is when we've got individual down cows that have, I guess there's a couple of scenarios that we can say. We can either say, hey, look, I don't have the manpower and the time to adequately do a good job of these down cows. I'm going to call a vet. They're going to come and do some of that hard work and heavy lifting for me. They're going to have a good look. They're going to intervene, and they're going to, I guess, make some recommendations. They're obviously not going to be there rolling them every 3 hours, so there's a limitation to that. But if you can't get to them quick enough, then maybe they can get to them a little bit quicker. The other time is when they've been down for a while and you've given them a whole bunch of metabolic products, you've tried lifting them, you've given them some anti-inflammatories, they've got good food and water, and they're just not getting up. Sometimes there is a real underlying reason. So if you're just having trouble getting them up and it's been, say, 12 hours, that's a good time to intervene. I have seen people intervene after 24, 36, 48 hours, and often by then the chances of them getting back up without intervention are getting slimmer and slimmer. So the earlier the better. Early intervention is always better. Early on-farm intervention and then early veterinary intervention can make the difference between saving a cow and not saving a cow.
Yeah, and most of us have been there. We've put in a lot of work and a lot of care into a girl, and sometimes we just have to recognise that actually the best thing to do is to put her down. That's a really hard thing to swallow.
Yes, it is. Yeah, and that's something that really needs to be a consistent farm policy discussion, decision with your team, is knowing when to make that call. And sometimes you will get a vet involved to make that decision, or sometimes you'll make that decision depending on, I guess, each scenario on individual farms. But that's a pretty critical thing, particularly for farm workers to know, is we've tried everything we can. We've taken as good care of her as we can. At what point do we just say, look, it's not appropriate for her welfare to keep this going and we need to put her down? And vets do have, I guess, a few extra bits in their toolbox. Outside of a very detailed clinical exam, you can inform that decision with blood work, and a number of vet practices have in-house diagnostic capabilities that can give us a rough idea of just how bad is the muscle damage that this cow has got, and should I be persisting? Is it in her best interest, and is it fair to be persisting?
Right, thank you for that. We've talked a little bit about treatment and prevention, but how can farmers go about creating a proactive management plan for preventing down cows and also providing care as part of their overall farm systems approach?
The best thing I've seen done consistently when I was in practice is whole farm discussions and whole farm input into that plan. And that involves all the workers, the owners or the managers, your vet, your nutritionist if you've got one. There are a lot of differing viewpoints that can come together to create a really good protocol for your down cow management. because it's really important that you get it right, and it's really important that everyone's on the same page, particularly large farms with lots of different workers. Everyone needs to be doing the same thing. So particularly as a farm owner or a manager, you can be confident that your down cows are being managed as you would expect them to be managed, and you're maximising your chances. So you're bringing an understanding of how do we do the nutrition side of Springer management and that side of things. How do we bring the nutrition side in and do that well? How do we bring the mineral balance side in and do that well? And more often than not, some blood testing at or around calving of multiple different groups can inform that decision really, really well. The greatest success I've seen is getting farm teams together, having a good session and saying, right, if we get a down cow, here is what we're going to do. And you have a list of things, and it's very consistent. And if you want to go as far as printing off and laminating a list to have on the farm bike to reference every time you see a down cow, that's a great idea. The other thing I've seen farmers do is provide each of their staff with sort of a down cow toolkit. And, it's on every bike. It's got a halter so you can restrain a cow properly. It's got metabolic bags. It's got anti-inflammatories. It's got everything that they would need to consistently treat the cow as per a farm protocol, which is a really good idea. Having a good stock of the required products is also pretty critical when you've got workers involved, so that they're not sort of constantly running short and you're having to duck into town twice a week to grab another box of metabolic bags. You sort of want to be prepared because, again, the faster we get to them and the better job we do of them in the early hours, the better success rates we get. Having a good on-farm policy makes a big difference.
Mitch, thank you so much for sharing your expertise on a topic that affects every dairy farmer. Managing down cows is something none of us want to see, but today Mitch has shared some insights with us that are incredibly valuable. We learned the reasons behind why cows go down and practical steps farmers can take to prevent it. And most importantly, Mitch highlighted the early signs to watch for and the importance of quick intervention and really good care to improve her chances of recovery. Thank you, Mitch, for your expertise and practical advice. And thank you to our listeners for joining us on this episode of Talking Dairy. If you'd like to find out more information on this topic, we've linked to our webpage in the show notes. Mā te wā, mauri ora. Thanks for tuning into this episode of Talking Dairy. Make sure to hit follow so you can keep up to date with our latest episodes. You can also keep up with DairyNZ News on Facebook, Instagram and LinkedIn, or go to our website and sign up for our fortnightly DairyNZ News emails. As always, if you have any feedback on this podcast or have some ideas for future topics or guests to have on the show, please email us at talkingdairy@dairynz.co.nz. Mā te wā, mauri ora, catch you next time.